Well,
Trying to set up our live here.
yes.
So.
Give us credit because this is the first time we do a live, so
Yeah,
we're
let's
trying
see.
to have all the devices in sync. Um,
2,
but
1, action.
now we can say officially hello to everybody. I'm Adriana Martinez.
And I'm Sharon LaBraca.
We both do our magnificent work at the Best You Health Boutique. That's the company ran by Sharon. Mine is Beauty Forum. And we're going to introduce you today to what we do for a living for a very long time. And I think coming with time comes experience and knowledge. And I do believe, I was thinking a few days ago that it's my time to spread the legacy and build the legacy since I'm approaching retirement. I hate to say that, but that's the truth.
I'll never retire.
I want to retire to do skin because I've done it all my life in cosmetic chemistry, and I am passionate. I go home, I think about compounds, about formulas that I have to make. I think about devices, like it's almost like a disease to me. Last night I was 3 o'clock, I was up, and I was just thinking about different type of IPLs.
Yes.
And how did I get into this business? And how did I get into lasers and IPLs, and how scared I was, and into advanced aesthetics or medical aesthetics, whatever other states have it under. Some, like Nevada has this advanced license on aesthetics called advanced aesthetics. Some of them, they have the medical aesthetics. But now I go back to literally my mentor, and the girls here in the office, they know that a day does not go by of me not talking about Miss Christine Valmy. She is everything that aesthetics represent to me. She is the person that, listen, she passed away in 2005. We are in 2025, and I literally think of her and what she taught me every single day. And she's the one that told me, at some point in your career, when you're going to feel very comfortable doing what you're doing, I want you to think of passing on your legacy. And I thought, like any mother will, children are my legacy. And she said, well, anybody can have children. It's a nature thing, but everybody having the knowledge you will acquire and what you're doing, that's not an ordinary thing. So you should spread that knowledge. And that's what we try to do here to our customers, to our students. So I'm going to pass to Sharon.
And so I'm a nurse practitioner. I'm board certified to practice family medicine, and I've been in the medical field for over 30 years, which feels really crazy to say that.
Today, every time I see her, I'm like, you don't age. You just don't age.
So it's an intentional approach to living, though, right? And lifestyle. Sure. So I represent, I think, what I'm trying to achieve for women. And any male. They're just a little bit more stubborn to bring to the
because
the board.
My clients, we share clients, and everything, but I have a lot of clients. They said, okay, Sharon was a ICU nurse practitioner. Why did she switch to this?
Yeah, so I was an ICU nurse, right? So in the thick of it, adrenaline junkie. We see kids not do so well. It was pediatric specific for most of that time. But I became a nurse practitioner, and I loved being a nurse. Okay, I had a great group of nurses that I worked with. We saved a lot of lives. The team was just incredible and amazing. I mean, when you see us at work, it's just something to behold.
Well, I know nurses do the harder work in any medical establishment.
Very hard workers. It's a lot of toll on the body. But my father got sick, and pediatric is very different than adult, so I needed to understand what all the meds he was on, and I didn't understand it, so I went back to nurse practitioner school to learn.
Get your master in nursing.
And yes, and I got a master's in nursing. You have to take like a national exam, and I became board certified, and I started to practice in integrative medicine, where it's chronic disease, it's internal medicine, not integrative. I now practice integrative. But internal medicine, where we manage people who are adults, some children, But what I saw was people getting worse, not better. Medication lists over the past like couple decades are just getting longer and longer. And I just woke up one day and it was COVID. And I thought, this is weird. So I won't even go into more of what I thought about that, but you know, maybe that's another topic for another time. And I decided that I could do better. I could actually
To
help people heal rather than give them things that weren't really necessarily doing that. Now, that's not to say traditional medical approach is not appropriate, because when you're sick, that's the time to seek medical attention and get medications. But I've identified there is a period of time before you actually get sick where your body is struggling at a level that you don't know about. You don't consciously, you're not aware that your body is dealing with these things. And so I decided I'm going to open a space and help people. You know, I want to change the world. And then I said, no, what? But that's how Best You Health Boutique was born, because I pretty much think that we could always become our better selves and the best of ourselves, the best
Well,
you.
what I can do to complement what you're doing, it's the same whether it's healthcare or skincare. When I say skincare, I'm not referring myself to products. For those who know me, I make my own products. Every single client of mine gets product made by me. I don't buy a skincare product and I give it to the clients. And it's years back when I was doing that, not because I couldn't make products, but I was too occupied, too busy, too tired, and then I would buy a product and customize that product for whatever needs everybody had. But what I can say, complementary to what you said, I see that you are actually educating your patients to
Yes.
prevent rather than heal.
Yes.
Yes, if they are at the point that they have to be healed, that's a different situation.
Right.
But I think people see a medical or a healthcare provider when they are already sick.
Right.
They don't realize, okay, we will get sick, we
Yes.
will get older. Bottom line, with every year of our life, the DNA
Yes.
strain, it's shortened and it's shortened and shortened. And the shorter it gets, you know, the faster we get sick, the faster we die.
Yes.
I mean, the more years we encounter in our system, the more inflammation we develop in our system.
Yes.
And it starts from everything. When people are angry, you get inflammation. When people, I can tell you, when I'm very angry, because I'm trying to control
Yes.
myself, I have a very volcanic kind of temperament.
Yes, yes.
And as I grow older, I learn how to control that. But when I get very angry,
Except for last week.
automatically I feel like I taste a metal taste in my mouth.
Yeah.
And I know that is the liver reaction to
Yeah.
that change.
Mhm.
I cannot even want to think what happens with the adrenal glands and how much cortisol
Right.
goes into my bloodstream. So what
Right.
I like about you, because I hear you all the time,
Yes.
your room is next to mine,
Right.
and I hear you talking to a patient when you say, we need to prevent this to happen.
And
Because
yes,
if
I talk
we
about
prevent-
oxidative stress a lot because people don't know what that is, but it is like it's something that happens naturally as we age. It's just the process how we use oxygen and we need it, and we create free radicals. And these free radicals, they're like toxins. They go around, and I describe it as they're slashing. They're like unruly children, slashing and causing problems. They don't know better unless your body, that internal wisdom that we all possess, helps to control that. Except that wisdom sort of gets corrupted with age, because a lot of the chemicals we produce start to go down. So when
Yes.
you hear things like
Or the absorption
glutathione,
of
the
those.
absorption, I mean, there's so much to it, right? But it's the glutathione of, okay, we make less of it. So we get to about 40s, we barely have any left. So we're accumulating all these toxins, and think of that as just, it gets muddy inside of our system. So we want to really scoop that out, and by taking external things, that's helpful, because that's what we do here. But I always want to tell people there's ways to promote your body to make these things.
Sure.
And that will be some of the things that we talk about as we continue to do this.
You know, I remember when I was practicing in New York, and I had a lot of clients with acne, and I chose acne not because I wanted, because it's one of the hardest skin condition to treat. Considering there are 5 types of acne, every acne requires a different approach, a different type of ingredients used, procedures, sequence of the procedures. With every acne treatment I do, I choose a different treatment every single time they come to me. I don't do the same treatment over and over again. And my very first thing that I learned to do when I was in school is to find out what is the bacteria that cause the acne. Because I hear people saying, oh, it's the hormones, it's chocolate, is whatever, fast food. No, it's not that. Those, yes, it will interfere with the proper behavior of the sebaceous glands. However, we both know there are 2 airborne bacteria that cause acne. One is the Propionibacterium bacterium, the other one is Staphylococcus aureus. So if we have a bacterial infection in our system, why are we dealing with Accutane on the face, which is a toxic amount of vitamin A? If it would be beneficial for the skin, the doctor will not, or body will not send that patient to a blood test every 10 days, because the risk of having the liver completely shut down is very high. Okay, not to mention what Accutane does to the lithium in the brain, which we know is the mineral that maintain the balance, emotional balance of our brain. A lot of people on Accutane accuse depression, or some of them, they committed suicide being on Accutane. It's a fact already known. However, I always tell my clients, if you have a bacterial infection, would you take a vitamin to cure that, or an antibiotic? Obviously, the answer is antibiotic. So what I was doing, I was referring my clients, before I even touched them, to a lab test. So they would do an antibiogram to see exactly what's the type of pus is in there, what is the bacteria spreading, the spores within 48 hours. Then they get the antibiotics. And within literally 3 weeks, because I tell them, you're not coming back to me earlier than 3 weeks, their pimples are pretty much gone. It's funny that you mentioned that oxidation and everything happens in the body. I had a discussion recently. I had a discussion with a client that said that, well, I'm supposed to having these issues because I'm aging. I said, yeah, you're aging, but the skin dies 20 minutes after the body's dead.
Yes, and then that's the part, you see, that we want to change with like what we're doing, is that entire concept that, oh, this is how it's supposed to be because I'm getting older.
Not at this rate.
And it's not true. Okay? And besides that, there are a lot of things we can do to help our bodies age so that we can age better, age with grace. But go ahead.
And age in a way of us still being able to be active, to be cognitive, to be able, like I would say, I want to age, and I'm okay with myself aging, but I want to be able to, at 70 years old, to be able to dress up myself, to walk by myself, to not depend on someone.
At 70, I want to be.
You probably still will.
I'm keeping this figure until I die.
You still will. I'm positive of that. But see, I explained this. I had a discussion with a former student of mine yesterday, actually. And she was telling me that, you know, she seems that she's not growing in the business, and she graduated in 2010. I was her aesthetic instruction back then. And I said, okay, how many classes did you take ever since?
Right.
And she said, well, I took few, like what? Exfoliation. I said, okay, you wasted your money because, okay, do you have a ultrasound device as such a scrubber to do the exfoliation? No. Then why are you taking the class if you don't have the device? Okay. Do you know how to do alpha and beta hydroxy properly? There are so many combinations between these acids to do exfoliation. Do you know how to use them? No. Do you know the difference between them? Because you cannot use lactic acid for exfoliation. It's a cell renewal acid versus mandelic acid, which is an exfoliation and anti-pigment acid.
Yes.
So you have to be able to choose the right compound. Okay, and I said 15 years passed by and you are still doing basic facials. Obviously, you will never grow. Your income will be barely covering your needs, and from that comes the deception. You went into a business that doesn't fulfill you. but it's not the business, it's you.
Right.
When you're gonna accept the fact that every single day you have to learn.
Right.
At my age, I mean, I'm
Still
2
learning.
years away from retirement, and I'm still learning. I'm still reading. I'm still talking to chemists. I'm talking to manufacturers. I'm talking to laser manufacturers. I'm talking to professional in my category. You have to study.
Take courses.
Take courses.
Study.
Nowadays, it's much easier because a lot of courses are online these days. That
Right.
you don't have to, go to school, dedicate 6-7 hours a day, and then you come home, take care of the family. But I
Yeah.
asked her one question. I said, "What kind of treatment would you like to do?" And she said, "Anti-aging." Okay, define what's anti-aging to you. And I was stunned. I mean, 15 years after you got your license, you give me this answer. Anti-aging is, the processes where you delay aging. I said, what caused the aging of our skin? Skin is only 1 out of 10
Yeah.
systems of our body. Yes, the largest one, and the second complicated after the brain. But still, what caused the aging of our skin? And she couldn't give me an answer. And I said, 2 factors. Only 2 factors lead to that aging process to be speed up. Oxidation, okay, and inflammation. If you learn how to stop that or delay that,
Slow it
you
down.
have an anti-aging effect.
Yes.
And you by yourself, as much as you are probably one of the best esthetician you could ever imagine, you need a doctor on your side. That's why you and we work so well.
Yes, the
Because
collaboration.
you know how many times I go to you and I said, I spoke to the client,
Yes.
this is what I see. For instance, I see the liver spots. I don't even take their money because they're, can you do laser? I refuse to do that because I will remove those spots.
Yeah,
However,
they'll come back.
they will come back because
Yeah.
they are liver spots.
You have to do something internal to help the liver to heal and detox your system, which is where we work so well together with many of these clients who will actually, or who are coachable and listen to us. Because, which brings me to a question as to how and why how you practice aesthetics is different than, when you think aesthetics, you think, oh, go to the spa,
Do a
get your
massage
fufu,
and a mask.
this thing that I see you do, and I'm like, oh my gosh,
Yeah.
like tell,
But that's not aesthetics.
right, so how is your practice different than, let's say, somebody who's just starting or, a lower level esthetician?
I tell you how it is, and I went through the same problem as the newer estheticians. I came out of a school, although was educated in Europe. School is way more in depth there, many hours, 2,300 hours versus 1,100 in Nevada, for instance. And then I took numerous other courses like Sudesco, courses and classes with doctors. So even if I'm not a medical provider, but I wanted to understand what's happening, especially with the skin behavior. Histology of the skin we cannot change. We are born with that and we cannot change that. What changes and leads to skin condition is the behavior of our skin, the behavior of those 6 functions. That's what it changes the way the skin act. So what I've learned back then, it was, and Ms. Valmy told me one day, because after 6 months after graduation, I was like, I don't see any differences on my clients. I'm wasting my time. I feel ashamed to ask for this money. I think I'm going to drop this business. And Ms. Valmy, in her wisdom, she just looked at me and she said, you need to go to Sudesco. You need to learn more. You need to get into advanced aesthetics. And that's how I started. But it's a correlation between really passion. I was telling my own son, I see this new generation, they become philosophers or whatever, and they never practice. They spend
Everybody
money.
tells you what to do, but
Yeah,
they
in
don't, they're
college.
not doing it themselves.
They end up with a huge amount of money they have to pay back, and then they go to another college or another school instead of learning a trade that you have a call for, okay? And then practice that for the rest of your life. This year is going to be 37 years since I'm doing this. Nothing else, And I love it every day. I don't come to work thinking, oh God, I have to go to work. No, I cannot wait to come to work because I'm almost like a computer. I have a chip for every single client. So this is the difference between what I do because I was taught differently. I see a person as a unique individual. Yes, every client has the same ribonucleic acid, deoxynucleic acid makes a DNA. but how those nucleic acid functions in our body makes us different. Okay,
Right.
I watched and I set the procedures, the protocol of the treatment based on the condition, not on the skin type, because the skin type never changes. What are changing is the conditions of the skin. So I make a list with the condition when I do a consultation. Then based on each condition, I will be like, which device will help me to address this condition? And then I add next to the device the compound that I make. Okay, meaning ingredients I put together to form that product necessary to correct that condition.
So let me just say that, okay, your background in chemistry heavily affects how you practice, but not everybody has a background in chemistry. So, you know, with the programs that we're creating, it's for the normal everyday person. They're still going to have to get, you know, whether they're getting it from you or whether they're getting it, you know, a good, you know, medical grade
They do.
product. But when you speak about how you're different, like how can you maybe interest somebody who doesn't have background in chemistry? Because this could be
You can learn.
overwhelming, I think, you know?
Yes, but think about this.
Mm.
When I went into this business, there was no internet. I spent many hours at the library, renting books, reading nonstop. I touched the computer at the age of 32. It was what it was, you know? And I was raised in a communist country. We did not have electricity, let alone computers.
Mm.
So if it's a will, there is a win.
Mm.
But you have to want that.
Mm-hmm.
I think people, if they study, you don't have to understand, okay, the movement of the electrons of the outer valence.
Right.
No. What I'm saying is, okay, understand this. If I have a burn or a burning reaction on the skin, what would be my choice to calm down the skin? You have to learn those ingredients.
Right.
Lavender oil.
Okay.
Maurice got the father of the aromatherapy, discovered
So
that.
there are basic things that
Yes.
you can teach somebody to handle a situation based on the skin type for aesthetics.
I'll give you a very basic example. Obviously, as I mentioned, every customer of mine gets product made by me. However, I had a customer went on vacation, forgot her nourishing lotion that it's used nighttime only, okay? And she called me and she said, I forgot my product at home. I don't know what to use. My skin is very dry. And I said, okay, since you are in a hotel, you definitely have access to brown sugar. Okay? I said, go take some brown sugar, mix it with water, and massage that liquid in your skin. Because sugar, it's extracted from sugar cane. Sugar cane is the source for every chemist to extract glycolic acid. You have a very low percentage, but that's all you need. You don't need 30%, 40, 60% glycolic acid. This is not what Dr. Van Scott ever recommended. It's just a little bit to start that process. And then you have that moisturization effect because glycolic acid generates hyaluronic acid in the skin. So things like that I teach them. Yes, if they want, like you carry here a medical grade skincare line, I don't have a problem with that. But if I take that product and I read the label and I said, well, yeah, but I need a little bit more emollients in here. I will add emollients
Yeah, so you
to
have
that.
to know how to get the
Yes.
product to what you want, the desired outcome.
But that
so,
you know by studying, Sharon, because
Yes.
I accept from every esthetician at
Yeah.
some point in their life to know what generate collagen
Right.
into the reticulary layer of dermis.
Yes.
Hyaluronic acid and vitamin C.
Right.
You can start with that. Learn what vitamin C does to the skin. Learn what hyaluronic acid does and where is it found in the skin. Then
So-
you'll be able to explain that to your customer.
What you say is resonates because on the same plane, you know, when you have these clients, the skin is the skin. So people can continue to get skin treatments, but if they're not supporting their bodies in specific ways, they're going to just continue to. It actually costs them more money to not support the body because the reason why we're seeking these treatments is because the cells are dying on the inside.
Yes.
Okay, the cells are being affected by the oxidative stress and inflammation you mentioned, and so it's really important to have an internal to external effect or view in how
Sure.
you have these treatments.
Sure.
So let's kind of segue into talking now about some of the treatments that we actually do here, you know, just so that people have like an idea about what we do.
Well, I can tell you how I start a treatment. Obviously, I reanalyze the skin every 6 weeks because the skin changes the behavior every 6 weeks.
Right.
Why? There are 6 functions in the skin.
Right.
So you have to take that in consideration. You cannot start with the client and then never reanalyze the skin, readjust the protocols to what the skin needs.
So what is it that you, like, what are the treatments that you do? I know you do cavitation. I know we're talking about skin, but I'm switching it up a little bit because you do so much.
My treatments are based on the equipment I have, the devices I have, the modalities.
Which are what? Let's tell
for
our
instance,
audience what you have going on here.
Okay, I have all the frequencies of ultrasound. I have 1 megahertz, I have 3, 5, 10, 40, and 80 megahertz. Every single frequency is used for a different condition. So for instance, if I have someone that comes with puffiness, I pick up my worm 1 megahertz ultrasound and I'm performing a lymph drainage with ultrasound to empty the tear gland and drain the lymph underneath the eyes. If somebody comes to me with an acne, okay, and with acne comes broken capillaries because the sebaceous gland's expansion, it pushes against the capillaries and those capillaries breaks, the blood oozes out and inflame the tissue in the neighborhood of the capillaries. And then I use 10 megahertz cold ultrasound. Depends on the condition. If I treat fat, subcutaneous layer, again, depends on that because I can use 40 megahertz, I can use 80 megahertz.
Without getting into the specifics of each treatment, just what are the things that you do? Like I hear you talk about microcurrent for what, and
I can
you
tell
talk
you
about
what I do.
we do ozone therapy with you add different things with it.
Needling.
You know?
I do exfoliation, all kind of exfoliation. Most of it is mechanical, so I use devices to exfoliate the skin.
Right.
I do microcurrent.
Yes.
All the devices for the face and body. It doesn't matter what it is. I use sporadic current to exercise, to do a passive exercise on muscles, especially on elderlies after 50 and up. I do cavitation, like I said. I do micro needling. I do.
And the cavitation is for weight loss, right? So it's helping to
contour.
Yeah.
And then I do radio frequency, different type, monopolar, bipolar frequency, depends on the area of the body.
Yeah.
I do all therapy. I do hydrotherapy. I have an endermology device, so I do endermology as well.
And what is endermology?
Endermology is a physical movement. It's called macrodermomobilization. That's the medical term for it, where you actually mobilize and move the fat.
Okay.
It should be done after cavitation because cavitation is the one that transforms physically the fat from solid to liquid. Otherwise, you cannot get rid of it from the body. Enter the excretory system. So within 2 hours after that, you actually urinate and you poop and you lose that fat. Okay. But in order to move that fat out of the body, I have to follow up after cavitation with endermology to move that fat into the excretory system. Okay, and of course you contour the body with that. I do chemical pills, especially in the colder season, all kind of chemical pills. Those are just few of them. I mean, pretty much, nowadays I'm a little bit sad, not frustrated, because new devices are coming up. But once you learn, what do you say?
The different treatments
and modalities.
So we also do Morpheus, so I have to give a plug to that. It's a way of, it's a non-invasive face lift, right?
Yes.
And it takes several sessions. We have the laser devices. We can, treat different skin conditions with that, combining what you do with that. But I want to kind of talk about what I do, and how we work together, which is, it's I don't like to say anti-aging, pro-aging, I don't know what you call it.
Well, it's
gracefully
a term
aging.
that everybody
Gracefully aging. But so I developed the La Braca method. And what I do is take people through the process of reducing that inflammation you talk about. Because no matter what you do, if you do traditional treatments, if you're taking a ton of medications, this stuff is going to help your body respond better to it. So things like microcurrent neurofeedback, for example, that's a part of my process. And the reason why that's a part of my process is that the nervous system accumulates inflammation, and it's hard to get that inflammation down. So we do, it's like an external, it doesn't hurt, you put these leads, and then you soothe the brain, and the research shows a 95% reduction in depression and anxiety. So what happens when you do that is your system, the immune system, and the rest of your body starts to calm down. So those high cortisol levels and the different things that happen during inflammation, high ferritin, high insulin, that makes you hold on to weight, they start to go down. We work on that through homeopathics, herbals. If I have to prescribe medicine, I will. So that then, is huge for my weight loss program. But I had a client yesterday who came in and she was asking, well, what about labs? Well, all her labs were perfect just 4 months ago. What do I need to do labs for? So I don't really lean on labs very much. I like to see at the energetic level, meaning we are energy. So you talk about chemistry, the chemical level, we're transferring electrons. That's how our bodies work.
Well,
it's
electricity is the core of chemistry.
It's the core of it, electricity. So we don't look at that as a traditional medical to say, okay, what does the energetic part of our existence do with the matter? And there's a total disconnect with that. Some people might say, oh, this is the spirit, or, whatever you want to call it, juju, but it's not juju. It's actually, it's
science.
Physics, it's science, it's chemistry. All of that is how our bodies work. And so that's a huge part of my process in looking at meridian stress points, because they were onto them back, way when they were doing Eastern practices, looking at chakra, which are energetic centers, and determining what system has inflammation or what organ, system, glands are kind of plugged up, where we have an internal wisdom, an innate wisdom, which allows us to heal, allows us to breathe, allows us to do all these things we don't even think about. So when someone comes to me with whatever problem, they get better because I am looking at the root. I'm looking and building the body from that foundation up, which is the difference. So hormone therapy, I call it hormone optimization, because people tend to think hormone means, reproductive hormone, but we have so many other hormones in the gut, peptides in the gut. We have hormones, that the kidneys are responsible for, your thyroid. And so when I say hormone optimization, I'm looking at all of that, putting that into balance, boosting the cells with treatments like the infusions and, ozone therapy, which we can talk, science and say NRF2 activation, where this is the core, the cusp piece of reducing oxidative stress in the body. All of that. So people think about NAD, glutathione, you hear these buzzwords, biohacking, but really what we're doing is getting the cells to respond better, to get the cells to communicate better. So that's how my mind works when I'm looking at these things. If I'm doing Botox on someone, if I'm doing fillers, I tend to move more with using PRP and making that PRP product into a filler where I can inject it back to the person. It's safer. It gets collagen stimulation. It gets the body to integrate this product well without distorting the face. And we see a lot of people, that look distorted because they keep putting things without actually going to the root of why we're seeking these treatments, which is the fact that our cells are aging, and so they're not doing what they're supposed to do. Now, if we get the cells to respond and work and communicate and die off and clean themselves up in the ways that we're designed to do, you have youth and longevity longer. So, people might wonder, well, why do you do something for the brain when you're doing these other things? That's because I see the body as one whole thing. It's not separate things.
And the brain is the engine of our body.
It is. So you come to me for something, a rash on your finger, guess what I'm thinking? The same thing. Because that rash is telling me that something internal is going on.
Absolutely.
Why?
Yeah.
So then we just kind of seek that out and do
That's
like
why
a push to it.
you and I, we worked so well together yesterday, and you know who I'm talking about. I had a lady, and when she was doing the IVs with you and the collagen supplementation through IVs, her skin looked phenomenal. She's not definitely old. I don't consider a woman 65 being old. No. Yet I see that crepey skin.
Yeah.
coming back.
Yes.
And
But she
although-
hasn't had any treatments in a while.
in a while.
right? So-
Although yesterday I did a carbon peel on her, or a Hollywood peel, whatever has different names, with a laser, I noticed that, and I was telling her, you need to come back to Sharon. First, I'm positive, I recommend, I'm positive she'll do this, cleanse your liver, okay? Secondly, add amino acids blend into that IV to support the elasticity
Right.
of your skin and pliability without cracking the skin and the fibers. And that's exactly what she's gonna do next time. So that's how we work. I mean, I cannot fix something like that. Even when, with all the knowledge I have, it comes from inside of the
out.
body.
Yes.
So when I see something like that, I'm like, this is where my expertise stops.
Mm-hmm.
I do this up to this point, and after this point, I seek medical help.
Right.
Okay, on my clients,
Yes.
and that's how I think people should do. Because I have not so much lately, but in my early year of my practice, I had women coming to me and they said, well, you know, it's just very expensive to take care of your skin. I said, depends. I can take care of my skin spending $5 a day.
Mm-hmm.
Okay, but you have to start with the age of 24. If you wait until you have the first wrinkles, the first expression line, the first spots or infection, it's already too late. And it's
Correct.
going to take a long time to correct that. You know, people needs to understand, as you brush your teeth every day, you have to take care of your skin every day, because it's a very large organ, covers the entire body. It's the mirror of our body. When you look, like you said, to someone, you see something and you can tell something happens in the body. You know, something is wrong in the body, and that's what you get. You come with expertise, say, okay, I need to do this and this and this. Sometimes, and I met few doctors in my life, they were very good diagnosing the patient without necessarily test, by just talking to them,
Yes.
listening to the symptoms, and they
Correct.
knew exactly what the problem was.
Mm-hmm. Absolutely. And so, with that, what do you want us to leave our viewers with?
We were talking because, you know, when you get to our age, you get also busy. And not because you're special, you have enough experience to develop a very good clientele. So we kind of neglected the fact that there are other people in our field that need help. And I was talking to Sharon. I've been always an educator, but I talked to Sharon. I said, you know what? Let's use the technology, technology to do classes in the most affordable environment for everyone. Because I would like to stay home and watch, and I do. I watch a lot of classes on Zoom. I take classes. I watch videos of people smarter than me, and I educate myself even more. So what we're gonna start soon, we start of doing Zoom classes. Some of them they will be free. Some of them they will be based on a certain charge. Nevertheless, they will be affordable. I guarantee you that. And we try to do it on Zoom because it's easier for us. Our location here is a good space for what we do, but it's not good to accommodate 30, 40 people. And most of the time we have a lot of requests for classes for a large number
So there
of people.
will be limited space.
Yeah, and then they don't fit in our space here. So that's what we're gonna start soon. Hopefully by the end of November, we're gonna have the first class. And based on what you, everyone that watch us want to learn, that will be the subject matter for a future class.
Yes.
Okay.
And for estheticians, you know, we have the capacity to certify them in certain
Yes,
things.
every
so,
class will
yes.
be followed by a certification. Many of you are going to be using that for your continuing education and for also updating your licensing. But I want to lead you to this message. Don't learn because the state law requires you to go through the classes. Learn because you want a better life, and a better life comes with better education and with a better successful business. I've been self-employed most of my life. I mean, with few exceptions, what I had to when I came to United States, I came with a work contract. I had to work for that company. But you know, as soon as I got my green card, let me put it that way. Okay, I said, you know what, I'm good. I need to be on my own, and I think it's the best decision I ever took. I think I have it in me as well because I'm a very independent person.
So
And
do you think we want them to know that the dates, I guess, we'll announce for the classes? We'll announce what certificates?
we will announce, probably we have another very short video, and we're also gonna put in our social media.
And
But-
before that, you can actually call this number if you want to find out more about, getting in, 702-518-0801. And we're, if for inquiries, or DM us if you're watching this, if you have any questions about anything we've said, or any interest in anything, or topics you want to hear about, please do let us know.
You find us online.
Yes.
I don't do Facebook or Instagram. I know I should, but again, I'm not a very patient person. It's too
But the
much
tag
time.
is, if you go to Best UHB, meaning BEST, the letter U, and HB.com, we have a lot of information there too.
Yes.
We'll be, putting more information on there as the classes unfold.
You can
So
find us on
You can
TikTok,
find
both
us
of
on
us.
TikTok.
Mine is Beauty Forum, and you can find me on YouTube. It's Aestheticos, which, by the way, very few people knows what that means. Aestheticos comes from the Greek word that means taking care of skin, and that's my YouTube channel. I decided to do more videos, not because I need to fulfill my ego. No way. My life is very busy. It's because, as I said, as I'm growing older, I speak with so many estheticians, so many people that work in the beauty field, and I realize how much more of a knowledge I acquired that I need to share with other people. And as long as I can do that, I will do that. Yes, I will retire at some point touching people's face, but I won't retire from being an educator. That's not gonna
Amen.
happen.
We've got
Yes.
a lot to say and a lot
Yes.
to offer. So thank you for
So-
tuning in.
Well, thank you so much, all of you. I hope you've been patient with us because, like I said, we know what we're doing. Definitely we do. We do not know technology that much. And I speak for myself. I'm not, I look at this generation handling the devices and I'm like,
I know.
I feel like I'm dumb,
Yeah,
you know?
yeah,
But
yeah.
it comes to with experience and practice like everything else. Shoot us any questions, anything you need help with, medical-wise, Sharon will take care of you. Skin-wise, I'll take care of you. I can guide you to your home regimen, to what you need to do to fix a condition or another. And hopefully we're going to have a beautiful collaboration. Thank you so much. And you have a lovely, lovely Halloween.
You do that.
Yes.
And I'll be dressing up, I think.
I don't have any costume.
Yes, I'll
All
be
right.
dressing up.
Okay, we done? We done. We have to be done on YouTube as well. Thank you again, everybody. I think it was good, and I think we definitely have to do this more often.
How many people did I have on there?
95 viewers.
Really?
One comment. 163.
How many people did I have on there?
95 viewers.
Really?
One comment. 163.